Well, back with Dr. Darj. Dr. Darj, tell me about missing teeth. And let me tell you what I kind of have found out, that as patients, we have a missing tooth, usually in the back, because when we have one in the front, we do run to a doctor rather fast because it's very ugly to have a missing tooth in the front. But when we have missing teeth in the back, not so much. We don't seem to be so anxious of getting it fixed because it doesn't look like it's a big problem. For a week or two, it feels a little uncomfortable, and there's this hole there. We realize we bite a little different, fine. We get used to it, and it just seems to be fine. And yet, you dentists keep telling us all havoc can break loose. It's a bad thing to have missing teeth. So where does this contradictory come in? We think it's not a big deal. You tell us it is a big deal. Shed some light on it, Dr. Darj.
All right. This is what I tell my patients. If let's say my finger had some type of disease, would I easily tell my doctor, well, I got 10 of them, take one out? I don't. Normal people won't, and everybody laughs, but it's the truth. When you have a missing tooth, we shouldn't take this lightly. Other teeth shift around, and the occlusal table, the surface which we bite on and chew on, gets altered, and that puts undue stress on our muscles, in our face. It gives us an aged look, and it ruins it contributes to degeneration of the joint, which is the TM joint right in our jaw. And that's a very, very delicate organ.
Sorry to interrupt you. I heard that those joints are the most complicated joints in the body. Is that true?
Well, they're very similar to knee joints. It just gets delicate because it's so close to our skull. and treating that area can be complicated.
But in any case, what you mentioned here, what you're basically saying here, I think, and correct me if you're not, is as basically you described the teeth are shifting, the pressure gets shifted a little bit like a bad fence. You know, when you have a nice looking fence, it's straight, it's good, it keeps the dog out, never in. Actually, it never keeps a dog out or in. I mean, I have noticed that dogs always get out. But anyway, it has its function and looks good. So when the fence pole get crooked, they break, they look ugly. You know, it's not good anymore. When you sit on a straight fence pole, it's good. When you sit on a crooked pole, it goes crack. And that's what you're saying is happening, and it's happening with the joint. So does that have anything to do then why some people get major headaches, back pain, shoulder pain, neck pain kind of stuff from these joints here?
Absolutely. Absolutely, yes.
So does it come fast? Does it always come when you have a missing tooth? Or is it just very, very prudent to wait till it comes, and because once it's here, it's difficult to fix?
It's prudent to take care of, to restore a missing tooth area as fast as possible, because going back and correcting the damage can be very costly, and sometimes it's impossible.
Right. Never mind, I think that, while you have headaches, I mean, I'm a person who actually really literally never has a headache except if I eat bad eggs and, bad food, and then I might kind of get a headache for a while. But it's not pleasant when you have one, and I see it with other people. No, it's not. And then it can take a long time before it's diagnosed, because we normally don't equate headaches with tooth problems. So we end up at the doctor's office, then to neurologists, and after a whole bunch of testing and no answer, they send them to the dentist. So would you say that if a person is out there having headaches, neck pain, shoulder pain, and he blames it on the pillow and he blames it on everything, and has been at a chiropractor or two, and it might have helped for a while, but came back, and name it, all those little things, neurologist, would it be good for him to really get a visit to a good dentist and say, do you know about TMJ problems? Do you know about headaches connected with teeth? And do you know how to treat that? And if the guy says, I'm good at it, go and have him examined?
Yes, absolutely. Absolutely.
Good.
Wonderful. So yeah, it is quite amazing. Again, the teeth are connected to so much more. It's quite amazing. It's
right.
Whoever created us, let's just call that person God for a minute. And he didn't. His little thing here, he put the brain in it, he put the eyes, he put the nose, he put the ears. Super important organs. Not that a finger isn't important, but it's very important organs. So why would he have dumped something very unimportant right in there in that big package of importance, right? So
absolutely, right.
Well, all right. So basically get your teeth fixed. But what was that thing you mentioned about looking ugly? What does that have to do with a missing tooth?
When teeth shift around, it alters your bite.
And that makes you look.
And I see what you're saying. If you have certain missing teeth, your teeth provide support for our face. That's why an elderly person who has missing teeth has that sunken look. The chin gets close to nose. That's the look they get when they're missing teeth. So the teeth actually give us the youthful look and the facial structures and the support for our muscles.
So fixing a missing tooth eliminates the plastic surgery.
No, I wouldn't say that, but it'll definitely give you facial support, and it would prevent the aged look.
I got it. Wonderful. Thank you very much, Dr. Darj. Thank you very much.